Hi everyone, I'm the director for our New Zealand registered not-for-profit Common Knowledge Trust. And for 50 years I've actually been involved with pregnancy and childbirth. And I got COVID in 2020. I also am a naturopath with lots and lots of experience of working with people with disability, sports performance, athletes, and all sorts of stuff. So I took care of myself when I realized I had COVID, and I've taken care of myself during this post-COVID chronic period. Do I get discouraged? Um, I get a little bit mystified because this is new and it's really unfamiliar. I need to pay attention and I need to commit to my own wellness. Doctors at the moment really don't know what to do. Many of you on the forums are taking medications as though they're going to fix you, and often they don't fix you, and you're still left with symptoms. So as I've said in other videos, sort of try to group the symptoms as to what happens together and then see them as episodes. And then your job in self-help is to try to find things that reduce the episodes, decrease how long they last, and increase the space in between. And by using that method, I have gotten much better over a period of time. Who knows? Did I have anything to do with it? Or does you just, run out of when this impacts you? I don't know. So today I'm going to go over some of the breathing exercises. As I said in the description, look up humming for nitric oxide. That's not Buteyko, but it's included now in the Buteyko training. But humming, you don't want to hum here. You want to hum here so that you feel the vibration. And the nitric oxide gathers here and here. And then after you've hummed, which is an exhale, breathe in your nose and invite that nitric oxide into your system. The other way to produce nitric oxide is to go out in the sun and get sleepy. That's doing the same thing. But you want to develop nitric oxide because you want your blood vessels to dilate, and then you want to improve your breathing so that the oxygen can then move through your more open blood vessels to reach your organs and your tissues so that you're less tired. In some ways, even though many people will roll their eyes at me, the recovery in the long haul is just like an athlete that's been injured and they want to go back to better performance. So if you treat it like that, rather than treating it as, as something that is either you're going to get better or you're not better, then you'll find ways. Also, you can follow what's called the fascination principle so that you remind yourself that you just have to keep on trying different things and paying attention to those things and seeing if little by little you can improve over time. So the first Buteyko exercise is for anybody who has a stuffed nose. It's not an uncommon acute symptom nor a chronic symptom. Many of us had it beforehand. We can have indoor allergies. We can have all sorts of issues, and our nose gets stuffed. And because when we breathe in, the air has to come in through our nose. If our nose is stuffed, then we're not efficient breathers. So when you do this exercise, you're going to take a normal inhale. You're not going to inhale like that. You're just going to take a normal inhale and a slight exhale and then pinch your nose. And then hold it until you feel the slightest urge to breathe in, which may be a nanosecond. Then breathe in your nose because you're producing the nitric oxide and you're training the breathing center in your brain to accept the reality of being able to not feel breathless. It takes time. You do it 3 times. You can do it 3 to 5 times a day. If you need to, do it lying down or sitting up. And then notice afterwards whether you feel, afterwards meaning 10, 20 minutes, whether your nose feels less stuffed. So this is how you do it. Just a regular breath in. So I'm not going to talk through this or else it's going to be confusing. And then an exhale. I'm going to pinch my nose. I'm going to hold it for what I want to hold it for. Then I'll do one with a person who's very breathless. Hold it for much less time. Then you're going to breathe in your nose. Then you're going to do 6 breath cycles, 6 in, 6 out, 6 in, 6 out. And you want your breath to be as settled as it is if you haven't done it. If you're finding yourself breathing more aggressively, then you've held the breath too long. You don't need to hold the breath too long. The purpose isn't to prove anything. The purpose is to become less breathless over time, which will help all of us who have long haul COVID. Okay, so you ready? So, yes, you want to be that calm. If you're doing a lot of this chest breathing, just do it for a shorter period of time. So this is unblock the nose, and then you wait for 20 minutes and see if your nose is clearer. The purpose of becoming less breathless is so that you are less breathless. That means your breathing's more relaxed. So that was your first exercise, unblock the nose. Your next exercise is just changing your habits. Begin more and more and more to breathe in and out your nose, rather than in your nose and out your mouth or in and out your mouth. Try to remember to do that. In Buteyko and in Oxygen Advantage, which is a bud off of Buteyko, they have a tape, and they tape their mouth at night. I've never done that. I've always been a nose-nose breather, but I had very dysfunctional breathing anyway. So if you want to tape your mouth at night, then you are forced to be a nose-nose breather. You can tape it during the day, but most people would look silly. So you just want to, little by little, shift over from mouth-mouth breathing to nose-nose breathing. That's your second lesson. Okay, your third skill for today is that if you're a chest breather, you are using the most inefficient parts of your lungs. So you want to use the efficient parts of your lungs, which are under your nipple line and to the side of your body. And to do that, you just put your hand on your belly, under your ribs, and then try when you breathe in to just expand your hand out. And then when you breathe out, let your hand come back. So if you're nose-nose breathing and belly breathing more and more and more during the day, you will feel calmer, calmer, calmer more during the day. Many people, when they talk, they then mouth breathe in. So I worked with somebody the other day who is a trainer. But she does it through Zoom and telephone. And when she talks, talks, and breathes in. Now that she's tired in her chest a lot. Okay. So when I talk, when I breathe in, I put my tongue to the roof of my mouth and breathe in my nose. I also try to expel less air at one time when I'm breathing out. So that's your third skill. Your fourth skill is to do the exhale breath hold when you're sitting, standing, and walking. Okay. Because as soon as we weight bear more, then our breathing can get more ragged. Many people on the long haul will talk about being fine at rest, and as soon as they stand up, their heart starts going wild, or their breathing gets really ragged. This isn't uncommon. This is a breathlessness. And I'll do a video at some point on the heart as well, because some heart stuff is not abnormal, and you need to check that out, because I had bypass surgery. I didn't have a heart attack. And after the surgery, for 3 years, I had very irregular heartbeats. And I was seeing a functional cardiologist who kept reassuring me that what I was feeling, which was incredibly distressful, was that it was normal and okay, and it would disappear in time. And periodically I have it, and yet I know I don't have something that is life-threatening to me. So it's important that you know that. So why are you doing these things? Why are you doing the unblock your nose? Why are you breathing in and out your nose and your belly? Why are you doing this exercise when you're sitting, standing, walking? Because you're training this center back here to accept a higher level of CO2. For most people, they're trying to have a higher level of oxygen. But many of you have an oximeter on your finger, and your oxygen levels are fine, but you feel breathless. And so you overbreathe. That's what asthmatics do. They mouth breathe and they overbreathe. That doesn't help. And this is where it becomes a bit technical. I am not a techie. And when I was learning this stuff, it was like hair pulling out because I didn't understand it. So I have to reduce this down to common knowledge. And I'm the director of a trust called Common Knowledge, so that's what I do, is I take information I don't understand and I convert it to a point that I can understand it and can explain it to other people. And this was something I did not know. I mean, there are funny things you don't know. I didn't know that the oxygen clings to the red blood cells and stays in our blood system. That's what you're monitoring. But it's not being utilized in your body. That's the breathlessness you're feeling, right? So you want to use your oxygen, and you do that by creating a higher level of CO2 tolerance, which in fact lowers your oxygen. People who have a very good high level of CO2 tolerance and say are runners, and they're not getting fatigued, and their breathing is not ragged, and they don't get tired on an ultra marathon, which all of us are going, how the hell are they doing that? That's because they have very high levels of CO2 tolerance, and their oxygen levels may be 84 to 87%, and sometimes even lower. It's not that they don't have enough oxygen in their body. It's when you develop the CO2 tolerance that the oxygen separates from the red blood cells and then migrates out into your tissues and to your organs. So you're using the oxygen better, and the result is you feel less breathless. And that's really good. One of the things I noticed, because when I became trained, I was really looking to improve my athletic breathing, which was fine unless I went up a hill, it got faster, and then it would get very ragged right away. And then I realized all my breathing was wrong. And one of it was, and I use that word wrong in a funny sense. I mean, it's not wrong in that I'm punished for it. It's inefficient for me. And I was breathless all the time without knowing, which meant when I counted my breaths per minute, I was breathing 20 breaths a minute. The average is 12 to 20, so I was right up on that top end. But functional breathing is 6 to 12 breaths a minute. And for most of us, particularly long-haul people, that's like fantasy, right? However, there is a breathing method which is not Buteyko, but it's quite good. It's called box breathing. And box breathing is you breathe in for a count, hold for a count, breathe out for the same count, and hold for a count. A lot of it will often be to the count of 4 or 5. So you breathe in for 4 or 5, hold it for 4 or 5, breathe out for 4 or 5, hold it for 4 or 5, and repeat. Because if you are doing it on a 5 basis, then you're breathing 3 times per minute. Most of us who are breathless can do it for maybe 1. So you breathe in 1, hold for 1, breathe out 1, hold for 1. That's 4 seconds, right, out of 60 seconds. So if you can do 2, then that's 8 seconds out of 60 seconds. So little by little, when you get more comfortable, then you're breathing less frequently. That's another word for greater carbon dioxide tolerance. Because when we don't feel breathless, we don't feel the need to breathe in right away. And one of the things that I noticed when I started was that I never had a pause. Not after the inhale, not after the exhale. So here's where it gets to be important within our body. Our diaphragm sucks up a lot of energy. Most of us have no clue really where it is or what it does other than it breathes, and we don't know how to impact it. The diaphragm's a bellows. If anybody knows a bellows, sucks air in. Most of us are actively breathing in and actively breathing out. Diaphragm should just suck breath in and it just push breath out. Most of us don't feel that. Most of us breathe in actively, breathe out actively. That tires our body. Okay? And it stimulates that sympathetic nervous system, the fright, flight, fight, freeze, tension. It closes down our lungs, closes down our blood vessels. So we want more oxygen into those things. And so we need to have a pause. And box breathing gives us a pause. It gives us a defined pause. And it's the same on the inhale, the same on the exhale. Actually, the exhale is really where the diaphragm rests. So the diaphragm's underneath the rib cage, and it goes down the back a little bit. It's under down the rib cage, right? And when we activate it, if we know how to activate it, the diaphragm flattens and just pulls in the air. And then when we know how to deactivate it, the diaphragm comes up into a rest phase. And when we get good at it, our diaphragm just wants to rest. And we don't feel a need to breathe in for quite a while. That's the more natural way to do it rather than box breathing. But it took me 2 years of working with the Buteyko and Oxygen Advantage and rethinking how my diaphragm was activated. So most of us, when we think about belly breathing, is we think actively breathe in, push our belly out. Actively breathe out, let our belly go in. And we get confusing messages about the diaphragm because you often hear it contracts in order to inhale. And you think, oh, that makes sense. You can't contract and inhale at the same time. And it doesn't contract, actually. It gets activated. So how does it get activated? I had to figure this out. And most people I've talked to, when they feel it, are surprised because they're not thinking that that's how it gets activated. So you have a rib cage that comes down like this, and the rib cage comes up like this, and the xiphoid process is right in the middle. Okay, so the diaphragm's tucked in there, and then remember down the back a little bit. But the diaphragm is attached to the connective tissue that's inside of us. So the whole inside of our core, our belly, inside of our rib cage, inside of our belly, pelvic floor, that all has white stuff on it. That's connective tissue. In fact, we have white stuff all over us. It holds our skin to our muscles, holds the muscles to the bones. It separates the muscle bundles from each other. It's our ligaments, our tendons. Everything pretty much is connective tissue other than our teeth, our hair, our bones. So the activation of the diaphragm occurs when the connective tissue at the bottom of the rib cage slightly pulls up. So you can sit or you can stand. And I'm not going to do either of those because all you then see is this big glob of red here. So I want you to just put your hands on the lower part of your ribs, right? Lower part of your ribs, down there, so that you feel that your little finger is really on your last rib. Okay, and it's on the side, not on your to the front. Get it to the side as much. And then what you want to do is to stop breathing for a second. And then just slightly, not like that, because it can't go up that way anyway, slightly just draw up. And what you'll find is that air gets sucked into your nose. Just pause until you feel you want to let it out. And then just draw down a little bit, and the diaphragm will just push the air out. When you're ready to breathe in again, just pull it up a little bit. It'll suck in again. Pause. If you don't feel like you need to exhale, then draw the hands down. The air will get sucked out. And feel the diaphragm rest. Because the diaphragm then just comes up and it rests. And if you don't feel like breathing in right away, just allow the diaphragm to rest because it's happy when it goes through rest phase. And then repeat that. We get better at doing that. We get better without our hands on it, right? Because mentally we can just say, draw up the ribs. The air gets sucked in. Bring the ribs down a little bit. And this is micro motion. Micro motion does a great deal. So if I have my finger here, I don't have to be here to feel motion. I can just think that I'm going to push my finger down like that, or just micro motion, and I can micro motion all through that range of motion, little by little by little. And as I micro motion through that range of motion, you can feel that all the way up your arm, all the way up your head, because the connective tissue is connected in one piece throughout our body. So if I feel tension anywhere in that micro motion, I can just soften and relax it. And I can do that with any motion in my body. That's kind of work that I do, somatic work. So when you're thinking about activating your diaphragm and you feel that connective tissue at the bottom part of your ribs activated, pull the diaphragm into its pulling, opening, inhaling phase. Then that stop after the inhale is when that connective tissue in the diaphragm is shifting from its inhale action and getting ready to go into a relaxation action. So if we're actively breathing in and actively breathing out, we never are letting our diaphragm really relax. We're just constantly holding it like this. And that's often why we feel breathless, because we have a very tight diaphragm that then robs blood from our lower extremities and doesn't allow the oxygen to diffuse into our tissues and organs, so we feel tired. And that all of that is stimulating the sympathetic nervous system so that we feel grouchy and irritable and tired and exhausted and frightened. And it's harder for us to recover. No one can make you relax. You can take all the medications in the world, and if they help you, wonderful. You can do so much for yourself. We're the first generation to experience this, both the acute and the chronic phase of it. We can help ourselves, we can help each other, and we learn more, and we can do more, and we can actually get healthier than we were before over time. So let's just refresh what we did. We unblocked the nose, which was just a normal breath in, slight breath out. Pinch the nose, breathe in when you feel the slightest urge to breathe. You breathe in your nose in order to gather the nitric oxide to dilate you. And you're going to do that 3 to 5 times. And notice 20 minutes later whether your nose is less blocked. And you can do that 3 to 5 times a day, lying down or sitting. Don't do it standing yet or walking yet. You're going to nose breathe more and belly breathe more. You're going to do box breathing if you can, to help slow your breathing down a little bit. And if that helps you feel calmer, you're going to embrace that calmness. You're going to try to activate your diaphragm so that it sucks air in, and notice the pause, and then deactivate it so it relaxes, and notice the pause. And you're not going to become frightened or alarmed if you don't feel like breathing right away, because ultimately you want to get your breath down to 6 to 12 breaths a minute rather than 12 to 20 breaths a minute. You want your diaphragm to relax. You're going to hum up here and then breathe in the nitric oxide so that that can dilate your blood vessels, so that when you can have a greater carbon dioxide tolerance and the oxygen is liberated from the blood cells, it moves out into the rest of your body. You can do these things. So that's all I have to say for today. Thank you for listening, and my hope is you'll pass this on and just go for it. See you later. Bye-bye.